feeding practices by upholding the 10 steps to successful breastfeeding. San Juan Regional Medical Center, officially baby-friendly and serving the Four Corners since 1910. Find out more online at sanjuanregional.com.
Twelve minutes past 8 o'clock. It is Tuesday morning, March the 3rd. Good morning, everybody. I'm Scott Micklin, and thank you for tuning in to KSJE 90.9 FM over the air in San Juan County, 103.3 FM over the air in Durango, and of course you can listen to us anywhere by going to KSJE.com. Good morning also to our viewers. We are streaming live to YouTube this morning. The video will be posted on Facebook very shortly, so stay tuned for that, everyone. And coming up this morning, I'm talking about CHIC, the Community Health Improvement Council here in San Juan County. We'll be talking a little bit about the Coalition to Prevent Child Sexual Abuse and some other programs that CHIC is involved with my guests. So stay tuned for that coming up in the next few moments on KSJE. Then we'll round out the 8 o'clock hour this morning by speaking with Amber Francisco over at the Farmington Regional Animal Shelter. She'll be showing us some of the pets available for adoption this week, including the dog on your screen right now. That's Gracie, who's available at the shelter this week. You'll hear more about her coming up later on this hour right here on KSJE. Roving with the Arts comes on the air at 9:06 a.m. It is Tuesday. Mick Hess has been playing Bach cantatas for us on Tuesday. This week is no different. You'll hear more coming up later on this morning, so don't forget about that. In addition to, of course, Facebook and YouTube, don't forget about KSJE on Twitter and KSJE on Instagram as well. And our social media platforms, by the way, is where we'll be sharing some of the vote results from the city elections happening today in the cities of Aztec, Bloomfield, and Kirtland. So you're following those city council races. You can see the results as we get them on our social media platforms, Facebook, Twitter, and Instagram later on this evening after 7 p.m. Our weather forecast, going to be a pretty nice day here in the Four Corners. Mostly sunny skies today. The high 58 in Farmington, 27 overnight. It'll be 60 and sunny tomorrow, 62 with sunshine on Thursday, and 65 with sunny skies on Friday, and partly sunny skies on Saturday with a high of 65. Maybe some showers coming into the forecast Saturday night and into Sunday with a high of 57 degrees on Sunday. And of course, we always say that visual radio can take you places. We're going to take you where a lot of hearts and prayers and thoughts are with the city of Nashville this morning after a string of tornadoes ripped through the downtown Nashville area overnight last night. The AP, Associated Press, is reporting this morning 40 buildings have been damaged or destroyed. 9 people lost their lives in Nashville. You can still see the heavy cloud cover there as the sun rises over that scene this morning, but a lot of thoughts, prayers are with the folks of Nashville this morning, where it is currently 60 degrees, a mostly cloudy day on our way to a high of 64 and an overnight low of 42, but no more rain in the forecast for Nashville. So let me talk to my guests who are here with us this morning, again representing CHIC, the Community Health Improvement Council. Amanda Evans is here representing CHIC. Good morning once again.
Good morning.
Welcome back to KSJE.
Thanks for having me.
Good to have you with us. Thank you very much. And also joining us on the phone this morning to talk a little bit about a program that she is involved with, Alisha Hawthorne-Martinez is joining us. Alisha, can you hear me all right?
I can. Good morning.
Good morning. Thank you for being with us as well. And let's start with you, Alisha, to talk a little bit about the program that you are involved with, this Coalition to Prevent Child Sexual Abuse. And this is a group of individuals from the community that are working together?
It is. Actually, it's a statewide nonprofit, and we are aimed at educating individuals and families across the state to make sure that everybody has access to age-appropriate prevention materials and the ability to talk to and begin a dialogue with their children in the hopes to prevent child sexual abuse. New Mexico is, worse than the country right now for child sexual abuse. and we are determined to bring this to an end.
Sure, and that was going to be my next question about how we rank compared to other places in the country, but we don't rank very well then, you're saying? We are the worst?
We are the worst.
Yikes. And so to try to fix that then, it's important to have some of these conversations with our children?
Absolutely. We need to begin having a dialogue with our children about body safety and sexual abuse prevention about the same time that we start talking to them about stranger danger. If they're old enough to start being read to and understand, then they're old enough to start learning about body safety.
Understood. And so when we talk to them about these types of things, and of course I know parents maybe always wonder what is the right age, but you mentioned around that same age, and you talk about body safety, that's the right time to be having these conversations?
Correct. And we also have the book, This Is My Body and It Belongs to Me, which you can look at on Amazon, or it's cheaper, more affordable, easier access on our website, www.preventcsa.org. But the book, This Is My Body and It Belongs to Me, is one of the pieces of material that we use. It's a book that I wrote a couple of years ago. We have it in English and in Spanish. And that book is really a great tool for parents to be able to use, parents, guardians, teachers, therapists, whoever it is who might be working with a child. And it goes through and it talks about body safety. It talks about the appropriate names for body parts. It goes through and it describes what may happen if somebody does report that they have experienced inappropriate sexual touch, and the way that they might be responded to with law enforcement's help. And it really has just proven to be an awesome tool in our community. So we have a number of different agencies that use it. One of them is San Juan Pediatrics. They hand the book out at every 4-year-old well-child checkup.
Nice, and that's important. And again, it's important to have these community partners to get the word out, as you mentioned. And so, as you talk about this and have these groups together, it seems like there's a lot more awareness about this problem in our country these days. We have laws on the books about mandatory reporting for individuals, maybe professionals who maybe suspect there's some child sexual abuse going on. Is that a good thing? It seems to me it is.
Oh, yes. I think that it's an amazing thing to have mandatory reporting laws, and I think that we are doing a good job about getting the word out. But I think that New Mexico especially still struggles with the taboo nature of the topic. It's just very difficult to talk about. You know, we do have programs that go into our schools, but the truth is we need our families to be having these conversations at home, because 93% of kids are perpetrated on by somebody they know, not a stranger. And so this dialogue needs to begin at home, and we need to empower individuals to get through and over, the discomfort of having this conversation, and really help them to be able to know the right words to say and the ability to interact with their kids around this conversation.
Understood. And again, you mentioned that many of these perpetrators are people that the children know, and I imagine maybe for other members of the family, that's kind of hard to grasp in many cases, is it?
It is, and the book actually talks about, there's tips in the back for parents and guardians of kids on what should happen if a child comes and discloses to you, because we all know that the first impulse is to go, when a child discloses and it's somebody that you know and trust, your first impulse is to say, oh, no way. But to do so is to really shut down the child in need. And so we talk about, letting the child know that you've heard them, that you understand what they're saying, that you're going to do what you need to help protect them, and that you need a moment. And stepping out to get your breath, and then calling and letting law enforcement do their job.
Right, that's important as well. And very important, as you mentioned, to not just dismiss the child offhand, I suppose, right? To really listen to what they're telling you and follow some of this advice that is available, correct?
Absolutely. We do not want to dismiss a child or make them think that we don't believe them. We don't want to shut down their ability to come to us with important information, and we need to just really take a look at the statistics. And the facts are that if a child's coming forward and disclosing, they probably have had something happen, and it's important to really listen. It's also important to not take it upon yourself to investigate the claims. but to allow law enforcement to do their job. I know it can be scary to trust in the powers that be, so to say, but they really do a really good job in our community of stepping forward and taking care of situations and making sure that our children get in and are interviewed by appropriate, well-trained individuals, and that if something has happened, that it's prosecuted.
And you mentioned earlier, Alisha, that New Mexico ranks kind of at the worst in the nation for these types of crimes. Could that also be because more of them are being reported, and could that maybe be a positive thing if there is such a thing?
I think I've been asked that question every time I've been on anybody's radio show, and I really should take the time to try to research that and find out, because I always have to say I'm not real sure. I know that we do have better disclosure practices today, but I also believe that our community is struggling. We know that New Mexico is one of the poorest states in the country. We struggle with substance abuse issues. There's a number of things that really come together to compound and make this such an issue, and I think that has more to do with it rather than more disclosures. But I could be wrong.
Understood. Well, I appreciate you saying that. And again, I think everybody, if anything is suspected, they should be an automatically report no matter what. And I'm sure you would agree with that.
Absolutely.
Very good. And in our area too, I know there are a lot of cases in the county, a lot of cases on the reservation. All these things, and sometimes it's easier to report than others, I suppose. Is that true?
Yes, we do have a number of different cases. So the Coalition to Prevent Child Sexual Abuse, we just went and presented at the National Human Trafficking Conference in Albuquerque. And the topic that I spoke on down there was the ugly truth, human trafficking from a family perspective. Because we do know right now in New Mexico, well, not in New Mexico, in the country, that 50% of human trafficking cases are actually being perpetrated by family members. And so we may have children that are being traded out for drugs and money, and nobody wants to think about that happening in our neighborhood, but it's a fact that this is going on.
Definitely, very sad, and totally needs to be taken care of and reported, as you've mentioned. My guest this morning, Alisha Hawthorne-Martinez, is here. She is representing the Coalition to Prevent Child Sexual Abuse. They are a member of CHIC, the Community Health Improvement Council. And, of course, KSJE has a monthly commitment to doing a program with members of CHIC each and every month to raise awareness in our community. Alisha, as you talk to folks in the area, and I think everyone certainly is behind your work and supportive of your work, are there any misconceptions that folks still have about this issue that you hear about from the community when you talk to folks? Absolutely. So some of those misconceptions are that only adults act out sexually and cause sexual harm. And we know that in New Mexico, 30% of sexual assault cases that are reported are committed by individuals under the age of 18. We know that there is the belief that females do not perpetrate. We know that is false. We do actually have female perpetrators. That only females can be victims. That's a myth. We have both male and female victims. The truth is 1 in 4 girls and 1 in 6 boys report sexual abuse in New Mexico by the age of 18. I think those are some of the major myths that come to mind right now. Understood. And so, again, for folks who are listening to us this morning and want to learn more about this issue or want to support the work that you are doing, you mentioned a website. Is there some other ways that folks can get in touch with you and the folks that are involved here and locally? Right. So our website, which was www.preventcsa.org, is available. We also have a Facebook page. The Facebook page does allow for dialogue back and forth if needed and does have our contact phone numbers on it. Also has numerous videos and links to materials that we have. Excellent. And again, you mentioned that it's just important to start having these conversations, but I know for some families it's a maybe difficult topic, or a lot of parents maybe are embarrassed to talk about these things with their children because they don't want to think that this could ever happen to their child, but it's an important conversation to have, isn't it? Absolutely. We need to have this conversation. I was just talking about this with another adult the other day, and I don't think that I've ever met an adult female who can say that she has not been perpetrated on. And that's the hard fact of our reality today, and this needs to stop. In fact, every single sexual abuse case is preventable, so we need to be educating and empowering our children. Very good. Well, Alisha Hawthorne-Martinez, I appreciate you being with me this morning and talking about this very important topic. I know you're not feeling 100%, so thank you for calling in this morning.
Thank you for letting me call in. I really appreciate it.
You're very welcome. Thank you, and get better.
Thank you. Bye-bye.
You're welcome. That's Alisha Hawthorne-Martinez from the Coalition to Prevent Child Sexual Abuse, a member of CHIC, the Community Health Improvement Council, speaking with me today on KSJE. Let me turn back now to Amanda Evans, who is here from the Community Health Improvement Council and the San Juan County Partnership. And a project that you are working on that we were talking about is a program with bicycles for children in the region, correct?
Well, not just children. We're looking for starting a program that would provide transportation through bicycles to all ages. So it might be children who need to get more active and, want to bike to school, or it might be adults that need it to get to a job or even get to, some of the services that we provide, that the community provides. I
see. Okay. And so this is the very, very beginnings of this program. You were reminding me as we talked before we came on the air this morning. And so you don't need folks to maybe donate bicycles yet, but think about it and be ready to do that. But you're looking for all kinds of things like storage, right, and folks that could maybe repair bicycles if they're not quite 100% ready to go, and then, of course, eventually the donations of the bikes themselves.
Right, and it's kind of a process. We are already getting people asking about bicycles. We have actually a family right now that has a foster son they just took in, 15-year-old boy who needs a bicycle to be able to get to school and around his area. So if somebody does have a specific bicycle that would fit that need, we would love to hear about it. They can call me at the partnership, and we can hook them up with that need. But as far as just taking in, a ton of bicycles right now, we still have to put that kind of infrastructure in place. So what we're doing this month is having a community meeting at 2 p.m. before our regular CHIC meeting. Health Council meeting is 3 o'clock on the third Thursday, so this month I think it's the 19th.
Right.
And so right before that at 2, we're going to have a meeting specific to this project around the bicycles. People who, it could be a youth group. Maybe you want to teach your youth at your church how to fix up bicycles to help, once a month do that. Or you might be someone who has a storage unit that you're willing to donate for us to store the bicycles. Or you might be someone in the community who knows people who need the bicycles. So it's kind of this whole program we want to put together and really have the community doing it. So it's not going to be, a San Juan County Partnership or even a Health Council thing. We want a group of people coming together to really make this work.
And bicycles really are kind of the key, obviously, to all this. And when we talk about for everybody, if you're a kid, if you're an adult, if you can't afford a car or you need a way to get somewhere, a bike can really provide a lot of opportunity for these folks.
Yeah, we live in a very rural place, so there's not always an opportunity for a car, but services might not be right where you are. You might not have a grocery store right next to your house, so you have to find a way to get there easily. You might need to get to work, things like that. And so we do, and we've got a community right now that's really focused on putting in bike lanes and making it safer for bicycles. And so we really want to kind of tag team with that and make sure, the people, we have this great infrastructure the cities are putting in for places to bike, so now we need to make sure the people who really need them are getting them.
Right. And so again, this is the start of this program. You'll be talking about it more at this community meeting on the 19th.
Yes.
And it's going to take place where? 2 o'clock?
At the downtown center. That's where the Chamber of Commerce is, and San Juan Safe Communities, and the old library is what I still call it.
Of course, right there at Broadway and Orchard.
Yes. And so we're in the upstairs conference room. So if you go in the front doors and go up the stairs, we're right there. You'll see us in the big room.
2 o'clock.
Yes.
On the 19th.
Yes.
And then the CHIC meeting, the council meeting, will be at 3.
Yes, and that's open to anyone anyway. So even if you can't make the bicycle meeting, or if you, want to stay afterwards, we're going to have some great presentations. We're going to have the Alzheimer's Association presenting, as well as someone from the court system on the new pretrial services program they're doing. And so we're going to have just a lot of community information shared, and it's a great place to network and find out what's going on around health issues in the community.
And as I always ask you every month when you're here, Amanda, remind us again, the idea behind CHIC is to bring together all these different groups to kind of talk about the needs in our community, right?
Yes, it's a place to make a difference, is what I say, because CHIC is not, we don't do like direct services. That's why, we're not going to build a building to do this bicycle program, but what we are is a place where community comes together and talks about the needs and figures out how, we can already utilize what we have in the community or where we might need to bring in more resources.
Right. And so this is one idea that's come out of those conversations, it sounds like, the bicycle idea.
It is. Transportation's been a big topic for years and years. I've been doing the Health Council for 12 years now, and it's been it's a conversation that never ends in our community because there are so many who, need to access things that may not have the ability to get a car and just drive straight there.
Right. And I was going to talk about the bus system that we do have here.
Yes, we do have some resources.
But of course, if you have a bike, you can put the bike on the
Yep.
bike rack on the bus and ride it to your next stop and then take your bike. So you don't, if you're not living or working or going to the store right near the bus stop, you can still get to it if you have your bike on the bus.
Right.
And using those modes of transportation.
Well, yeah, and again, you can kind of combine the two because we do have a great bus system, but you have to, it doesn't have a stop at every single street. So you still need to be able to maybe get to the bus stop, get from the bus stop to where you're going, or even if, you might be going a distance that you don't need a whole bus ride, but you need to still be able to get somewhere.
Right. Or you're like me and you can't ride the whole distance, and so I can ride a little bit of that distance, but not the entire thing. So,
exactly.
But there you go. But you could use the two, and
Right.
again, it's a great opportunity, and certainly cheaper than a car for a lot of folks, and so it makes a lot of sense to be able to provide these for our friends and neighbors. And you mentioned it's for all ages. So right now you've got a need for a child,
Yes.
but it could just as well be maybe an adult who maybe has been struggling and has found a job and needs a way to get there.
Right. We talked about this program 2 or 3 years ago and tried to get it kind of started, and things fell through. And at that time, we were working with TOTA Behavioral Health and the JIP program and stuff, and they still are going to be a big part of it because their clients and relatives, are people who can use these services when they're looking for jobs, when they're trying to get around in the community. So we're wanting, once we get this infrastructure in place, we're hoping it'll be all ages, from again, children who might need it to get to school to adults who might need just to get around.
Very exciting. So what we say in radio is stay tuned.
Yes.
Okay.
Yes.
And when do you hope to maybe get this up and running? Is it something maybe by summer we could maybe see some more activity on? Or I know you'll come back and tell us.
Well, and that's what we're hoping is this is a great time because people are starting to get out. The weather's starting to get better. You're starting to pull those bicycles out of storage. And so that's why we really want to have this community meeting where people are talking about, well, how do we make this work so that maybe, in a month or two, we can start actually collecting the bicycles.
And have a location to do that.
Yes.
There you go. That's always important. So if folks want more information and can't make it to the meeting on the 19th, they can still call you at the partnership?
Yes. My direct number is 566-5877. And like I said, if someone has a bicycle for a 15-year-old boy, I would love to hear about it for this foster family. If not, and you just want to be a part of it, you have a youth group that wants to work, you have space we could use, please let me know.
Okay. Very good. Anything else going on with CHIC that we should be talking about this morning?
I think that's our really focus right now just because of the timing stuff. But
Okay.
Again, we have these monthly meetings. It's always the third Thursday of the month, and anyone in the community is welcome. You don't have to be part of an organization. Just show up and hear what's going on.
Okay. Very good. Amanda, thanks for coming in this morning.
Thank you for having me.
Always appreciate it, and we appreciate CHIC as well. Thank you very much. Amanda Evans, my guest this morning here on KSJE. Back with more in just a moment, everyone. The time right now is coming up on 8:35.
The City of Bloomfield and its partners are seeking public input on the redevelopment of the old Arex refinery site, located at the intersection of West Blanco Boulevard and 5th Street. An interactive workshop will be held to gather public input at Bloomfield City Hall, 915 North 1st Street at 6 p.m. on Tuesday, March 24th. Snacks will be provided. Find out more from the Bloomfield Public Works Department at 505